For a lot of our adult patients, it is really never too late to do expansion and airway orthodontic treatments, especially when you're having problems. We recently talked to a 79-year-old who is successfully doing a MARPE, that is a upper jaw expander that can get a lot of widthwise growth. She was talking about a successful tongue tie and how she had had ADHD-like symptoms her whole life that have improved, if not resolved. We will see a lot of people in our practice where they've been told that they're over the age of 14 and the palatal suture doesn't expand anymore. That is categorically false. With modern bone level expansion, we can expand people at any age. There's certainly truth that it is more difficult to expand an adult than a child. Obviously, an adult's no longer growing, a child's actively growing, and as we get older, the ligaments that connect our cranial bones gets more rigid and they're more difficult to stretch. And that's how we get our expansion. So as people get older, the ligaments will get a little bit tighter. Some people have thicker palates, some people have thinner palates. It's a known fact that men are actually more difficult to expand than women. But we have people in their 40s, 50s, and 60s that we've expanded their palates without surgery. Sometimes there's a need to do a corticotomy, which is a procedure to loosen and cut through some of the ligaments to speed up and help with the expansion. But sometimes people, even in their 50s and 60s, do not need that. Either way, it can be a very conservative treatment. At any age, the expansion is considerable if people are having problems that may be able to be corrected with expansion and airway orthodontic therapy.